BW Healthcare World. Welcome to the special podcast series on patient safety by BW Healthcare World, jointly being organized with KAHO. My name is Harbinder Narula, and joining me today is Dr. Elizabeth David, a distinguished leader with over 25 years of experience in nursing, in clinical, academic, and leadership roles, for an insightful discussion on the vital role of a nurse in delivering safe and effective care. She's a PhD in nursing and a graduate of the Johns Hopkins Nurse Leadership Academy. Dr. Elizabeth has led transformative initiatives in patient safety, quality improvement, excellence. Now, as a mentor, speaker, and advocate for nursing empowerment, she brings a wealth of knowledge on how nurses can shape the future of healthcare through safe and effective practices. Welcome, Dr. Elizabeth, to BW Healthcare World.
Thank you very much, Dr. Narula. It's my pleasure and privilege to have this conversation with you today, and also to give an opportunity to kind of voice out for nursing professionals what we stand for and what we do. I think thank you for that.
Awesome. Much as I would like to be called as Dr. Narula, I'm not a doctor myself, but I get to speak with over 100 doctors every year.
I see.
Dr. Elizabeth, nursing is often described as a backbone of healthcare. Now, could you elaborate on the diverse roles and responsibilities that nurses handle in delivering safe and effective care in the healthcare setting?
Thank you for that question, Dr. Narula. Should I address you as Dr. Narula or can I just say Narula?
Just call me Harbinder.
Harbinder, that's right. So thank you so much for that question. And I truly believe that nurses are definitely the backbone of healthcare. In fact, I would say more than that, because nurses take on very diverse and very critical roles as far as safe and efficient patient care is concerned. They are the ones who are at the forefront of patient management, and they are there 24/7 in all different kind of healthcare settings, right from being a bedside nurse, which is, I think, one of the most crucial. And I would like to spend a little time talking about that in terms of the role that nurses play there, simply because, just being at the bedside, merely being at the bedside, nurses play multiple roles out there. So she can easily, I'm not being biased there, but a nurse can easily transform seamlessly from being that compassionate caregiver to being a very, a firm educator, to being a very resolute emergency manager, depending on the situation that she's put into. And the other reason why I want to talk about bedside nursing a little more is because, for the general public, especially maybe because of the culture of nursing homes, the perception that they have is that nurses are just meant to administer medications and probably check the vital parameters of patient. But I think nurses do much, much more than that. They start off with a very detailed physical assessment of patients, which can entail complete body assessment, spiritual assessment, including monitoring of vital parameters, including pain management and assessment and management of pain, and also evaluating a lot of other potential health risks that patients may have. In addition, they also deliver a broad range of evidence-based interventions to achieve the best possible patient outcomes. Nurses also provide holistic, compassionate care where they address not just the physical or the clinical aspects of the patient, but also look at from the emotional perspective, the spiritual perspective, and all other needs that a patient may have. In addition, they also develop a very strong therapeutic relationship with the patient by offering emotional support and actively involving the patient and family in the decision-making process. In addition, they ensure continuity of care by collaborating with the other healthcare professionals and being that the central person who kind of facilitates the entire care for the patient. So that is all about bedside nursing. And if you ask me, what was my best time in nursing? That was at the bedside. But yeah, there were reasons why I moved into leadership, which we can probably talk about a little later. The other roles that nurses play is that of an educator, as I mentioned. So when I say education, nurses are not just educating the patients, which they obviously do, but they also educate future nurses. They also educate the current bedside nurses, because if you ask any leader, they would confidently say that one of the most important aspects to ensure great patient outcomes is continuous professional development of nurses. So nurses do that. They also train other healthcare professionals, which can vary from, the one of the support staff at the patient bedside to even doctors at times. For example, in my hospital, that is Rajagiri Hospital, we work very collaboratively with our doctors, and we have nurses. So we identify strengths of people, which is irrespective of being a doctor or a nurse or anybody else. And there's a lot of training that we do among ourselves so that we strengthen each other. So nurses play that role. One of the other important role that a nurse plays is that of being a patient advocate. So she's the one who will ensure that the patients get the best care. In our hospital, we've got unit managers. They are the ones who are responsible for everything that happens in the unit, not just from a clinical perspective, but also from a patient service excellence perspective, a patient experience perspective. And they have got the empowerment to escalate up to the CEO in case of something that is missed, in terms of patient care. So that is kind of advocacy that we encourage nurses to do. And even at the bedside, a nurse will have that empowerment to ensure that a site marking is done. This is a safety measure that we follow. That if a patient is undergoing a surgery, especially, for example, let's say a TKR or a total knee replacement, it is very important that we do a site marking, we take a consent, and all of those things. Nurses are empowered to ensure that a patient is not shifted to the OT if that is not done. So, this is how nurses advocate for patients. We also have nurses participating in research and innovation. There's a lot of new initiatives that nurses bring in, as far as healthcare is concerned. Of late, there has been a very important role that nurses are playing, and that is of specialty nursing. Now, if you look at internationally, this is quite developed. We have a lot of nurse practitioners. We have nurses specializing in a lot of specialty areas. In our country, it's not yet developed still, but we are gradually, hopefully, progressing to that. And we have a lot of nurses who become specialized nurses, like diabetic nurses, stroke management nurses, infusion nurses. So these are nurses who become subject matter experts of that particular role, and they bring in a lot of expertise and thereby help us improve patient outcomes. Now, here I have an army of specialty nurses. Have been blessed with that, and I've seen that I can see a lot of patient outcomes getting better. We've been able to achieve good outcomes as far as patient care is concerned by this, with the help of these specialty nurses. And finally, one of the very important role that nurses play is that of being in leadership roles like myself. So you have nurses who come up to be chief nursing officers or nursing directors. So they handle this entire army of nurses. And I must say that heard a lot of people saying that it's very difficult to be a head of nursing, more difficult than to be a CEO of a hospital, because they're handling that large group of nurses, that entire army, which comprises of almost 50% of the manpower of a hospital. So training, developing, managing them is a big task. But having said that, we have nurses moving on to other leadership roles as well, which can be operations, which can be quality, which can be even heading hospitals. So these are the wide range of roles that nurses play in the healthcare of India right now.
Awesome. I think that's a very elaborate, uh, you know, uh, expansion of the role that you shared with us that the nurses are playing in the hospital. Now, how do you perceive the attitude of other healthcare workers and general public towards nursing profession in India? Because I've seen when people go to the hospital, there's a different respect that they have for the doctors, while the nurses are the ones who are actually spending more time. And as you said, that they're responsible for far beyond what their role is, but also in terms of creating the compassion and empathy in the forefront while dealing with the patient on the bedside. Now, has this changed over the years, especially during and after pandemic, where people have realized the role of nursing?
So as you rightly said, historically nurses in India have been undervalued all the time, and they've been often seen as subordinate to doctors rather than skilled professionals in their own right. The public primarily see nurses as caregivers. They kind of ignore, or they have not experienced the expertise in patient management and the critical thinking aspect of nurses. It has been overlooked, all this time. And this lack of recognition always has created certain challenges in terms of professional respect and job satisfaction for nurses. And if you ask me, though, as I told you, I enjoyed my bedside nursing experience, but that was one of the reasons why I thought I want to move into a nursing leadership role, because I wanted to make a difference, at least in the organization where I work. I wanted to make nurses feel empowered. I wanted to make sure that they are equipped with the right knowledge, the right skill, and the right resources to be able to stand up for their profession and be there as partners in healthcare, right? But now, fast forward to COVID-19, the pandemic saw a significant shift in that perception. Nurses were thrust into being that, the frontline heroes, and people appreciated them for doing what they were doing. And they played that indispensable role of managing patients, especially when nobody wanted to be, at that end taking care of patients. So nurses did all of that. And they also provided that, that crucial emotional support that was needed during that unprecedented global crisis that was happening. Stories of nurses were published, nurses were interviewed, and there was a lot of appreciation for that tireless work that they were doing, often at risking their own personal health and their own personal well-being at many times. So this helped humanize their efforts and kind of get an appreciation for what they were doing. They also got a lot of widespread admiration and gratitude from the public at large. They gained recognition for their role, and their contributions were finally acknowledged. They were considered to be valuable as far as healthcare is concerned. Now, coming back out of COVID-19, now has that appreciation, has that respect sustained? I would say yes, to a certain extent. But now people are back to normal. It is, all that the show is over. But there is still a greater acknowledgement among healthcare workers. There is still an acknowledgement to see that they are equal partners in healthcare. And the public's perception has evolved as well. So while nurses are increasingly being viewed now as skilled professionals equivalent to every other person in the healthcare fraternity, right? But having said this, I think despite this positive shift, there is still issues. There are still issues related to pay disparity. There are still issues related to limited career opportunities. There are still issues related to hierarchical attitudes in healthcare settings, and that continue to affect the profession. But I'll try to be I want to be optimistic, saying that it is a period of time when things are going to change, and we will have the perception being changed over time, as COVID-19 has catalyzed a positive change, and it's important for us to sustain and make sure that we build up on that perception change that has happened over the last couple of years.
And Dr. Elizabeth, one of the challenges that I believe that the industry is facing, specifically the healthcare industry, is uh, the hiring of nursing. You know, while and my perception is little different, and you can correct me on that. I believe that there are a lot of nurses, or a lot of people who want to get into nursing, but there's a shortage of trained nurses in the system. Now, how are we getting over this challenge, and how do these challenges impact the quality of care which is delivered in the hospitals?
Right. So, as you rightly said, I mean, it's a global challenge as far as healthcare professionals are concerned, and nursing is definitely top of the list. So, when you're talking about India, especially, we are facing several significant challenges in recruiting and retaining, I would say, trained nursing professionals. And one of the primary issues is shortage of trained nurses, right? So, the demand for qualified nursing professionals far exceeds the supply. And we know that many nurses seek opportunities internationally, which often leads to a domestic shortage of nurses. And this is compounded, as you rightly said, by the fact that there is inadequate access to quality nursing education and training programs, which hinders the development of a competent and skilled workforce. So it's a double whammy for nursing leaders like us, because on one side you have a shortage, you're not fulfilling the numbers that are required to manage patients safely. And on the other side, while you may try and build up those numbers to a certain extent, the nurses that you get on board are not really up to trained enough to be able to practice nursing independently. So we have to invest a lot of time and energy and effort to train these nurses in the hospital where we expect them to actually start working. So that's the challenge that we really have. In addition to that, the low wages, the poor working condition, it's like a vicious cycle, you know. So, and the long working hours, all of this make nursing not a very attractive option for the youngsters. So, you know, the kind of salary that a nurse gets is almost equivalent to what a call center personnel would get, or, you know, any of them would get. So, why undergo this 4 years of rigorous training? Why undergo this long working hours and, you know, all of those problems when you are still earning what you can earn being in those particular professions? So obviously the it's a less attractive profession. So what you said, I want to correct you there, that I don't think you have enough of people who want to be nurses. That's because the profession lacks the glamour, you know. And I think it's up to us to inside kind of make awareness to people that there is a lot that you can do as nurses. Now the challenges now because of the shortage is huge, because there is a huge impact of the shortage of nurses, of the shortage of qualified and trained nursing personnel, because you see that the quality of care gets completely affected because of lack of nurses. I mean, you have you know, very high nurse patient ratios. So you have nurses who are fatigued, you have nurses who are not able to give the kind of care that you want them to give. Many a times we get feedbacks from patients that nurses don't smile, you know. But the point is they are so stressed out, they're trying to meet 6 to 7 patients at a time, they're trying to finish their work in time, so it becomes very mechanical. So if you want nurses to be able to give in their best, we need to make sure that we have enough of people, we have resources that are going to make them feel you know, rather use technology to a great extent to see that nurses can be utilized more for patient care rather than filling in documents, filling in papers, and doing a lot of those administrative work. Understaffing also leads to longer response times. So when you're talking about patient satisfaction, it gets affected. It reduces patient interaction, and ultimately it decreases patient satisfaction and safety. Inadequate staffing can also lead to a lot of other compromised patient outcomes, such as higher infection rates, longer stay of patients in the hospital, increased mortality. Now, these are all findings which have come out through a lot of studies that have been conducted. So we have seen that happening, and I've seen that in person because, you know, at a point of time in my hospital, we were short of nurses because there was a huge attrition. And we had gone up our nursing ratios to a 1 is to 6 to 1 is to 7 in our wards. But and we saw the outcomes of that. We saw that patient satisfaction decreased. We saw that, you know, there were other issues, adverse events that were happening because of those high patient ratios. And now, when we look back, we've come a long way. Today, I would ensure that I have enough of nurses. We have got enough of nurses because I sit like a hawk on my nursing numbers. And there is constant discussion with HR because I want to maintain those numbers and I cannot compromise on that. And what we have seen is the outcomes. We've seen improved patient satisfaction. Our satisfaction has gone up from about 87%. We stand today at about 96, 97% of patient satisfaction. We've seen a lot of improvement as far as adverse events are concerned. We've seen a lot of improvements as far as pressure injuries, you know, fall prevention. All of those things have kind of improved quite a bit today when we have enough of numbers. So I think having enough nursing manpower, not just in terms of numbers, but in terms of competency and qualification, is very, very crucial to ensure that we have good patient outcomes and the quality of care does not get affected.
Awesome. And when you're looking at recruitment of nurses, the other challenge is retaining the nurses. You know, healthcare sector has often seen issues like high nurse turnover, and many nurses leave the country for better opportunities abroad for obvious reasons, salaries, better satisfaction, etc. What factors contribute towards nurses leaving their work in India for better opportunities abroad? What is it that they're seeking? And how can we address this challenge to be able to retain these skilled nurses in our own country?
Tough one there. So, yeah, so we are, as I said even earlier, we are grappling with this very critical issue of high nurses turnover and the significant brain drain. So, while many nurses are leaving the country for better opportunities abroad, it obviously has a very profound effect on the quality and accessibility to healthcare. as I was telling you a little while ago, we have young nurses joining our hospital, and a lot of them join probably my hospital because this is a JCI accredited hospital, it's an NABH accredited hospital, and they want that kind of experience, to show onto their resume when they look at jobs abroad. But the challenge that we have is we take a good 2 to 3 months to train them and get them to a level where they can independently practice nursing, but within about another 8 to 9 months, they're already on their journey to go abroad. So that's like a constant, challenge that we are facing. But nevertheless, we continue our effort towards training and developing them because we strongly believe that even if a nurse is working with me for one single day, I have to ensure that she is competent enough to take care of my patients well. But having said that, we also tell our nurses that we want you to be ambassadors of our hospital. We want you to leave the hospital on a very good note because we know they're going to go. There's no other way to do it at this point of time. But yes, one of the most important reason is, pay, as you rightly said, compensation, because we are not able to compensate them as the counterparts in the other countries, and that may be a difficult perspective to thing to look at because we may not be able to kind of get equal to that in terms of compensation. But having said that, I would also say that a lot many percentage of nurses do not go just from a compensation angle. It's more from an angle of career opportunities. It's more from a work environment perspective. It's more because we are not able to give them opportunities for growth. We're not able to give them, a career path for them to grow. I mean, in our country, you are a staff nurse, like a bedside nurse. So you either be there for years to come, or you have an opportunity to probably move into specialized roles, or you which are again not very structured, and move into leadership roles. Now leadership roles, it's like a pyramid. The number of leadership roles are very far and few, and obviously people like me who get into a leadership role will not leave until you retire, right? So you don't have a lot of opportunities for youngsters to get into that role very soon, and which is probably a reason. So I have my sister-in-law who's a nurse as well, and she is currently working in the United Kingdom, Scotland, precisely as a nurse practitioner. So we were having this conversation of why she left the country, to look at an international job. And like her, many other people have not left from the compensation perspective. They have left purely because they wanted to grow in their profession. They wanted to reach a position where they have an authority and at the same time not lose their bedside, care. Because I told you, a lot of nurses, a lot of us actually, have a lot of affinity and a lot of affection to that bedside nursing. So when you get an opportunity like that to be a nurse practitioner, where you are a senior in that particular profession, you have a say in what you're doing. At the same time, you are at the bedside offering patient care. It gives you a lot of satisfaction. And I think that is one of the reason a lot of nurses leave our country, in addition to the compensation. And of course, the poor working conditions and the lack of respect, the lack of recognition, all of that go together. So, yeah, so these are reasons why I think nurses leave our country and look at opportunities abroad.
And Dr. Elizabeth, hospital has a lot of workforce,
Mhm.
different workforce, and we are all human beings. Errors happen, right? So nurses can play a very critical role in ensuring patient safety, and that's what is expected of them. Can you share some examples of how nursing practices contribute directly to preventing the errors and promoting safety in the hospitals? What roles do they play in actually making this happen?
True. So again, nurses are at the forefront of patient care, as I keep saying that again, and they play a very important role as far as ensuring safety by consistently applying a lot of evidence-based practices and maintaining vigilance in their daily responsibilities. In fact, I think a lot of the buck stops at the nurse. Whether it be even a prescription error, whether it be anything else that anybody has done, the final straw is that of a nurse. And the final question that people will obviously ask is, why did the nurse not check it? So of course they are human beings too, but we expect them to be a lot more vigilant than any other healthcare professional. And that is by virtue, and that they do that very often. And I would want to credit a lot of missed a lot of errors that were missed or have not reached the patient, and I would like to credit that to the nurse. In fact, we have this award and recognition program in our hospital where we award the best catch. So the person who identified something before it reached the patient. Until now, it's always been a nurse. So that's how vigilant they are. So a lot of especially when it comes to a lot of things related to patient care. One of the major one being that of medication administration. So medication administration, medication errors are one of the leading cause of adverse events in a hospital. And the nurse is the one who is always meticulous when it comes to administering medications. She's the one who will ensure double checks. She's the one who will coordinate with the clinical pharmacist, coordinate with the doctors, coordinate with the pharmacy to finally ensure that she's giving the right drug to the right patient at the right time at the right dose, and all of those rights that we talk about. Other than medication administration, the nurse focuses a lot on infection prevention. I mean, we all know that the nurse is the one who spends the maximum time with the patients. She is the one who's got that maximum interaction, maximum interventions when it comes to patient care. So it's very important for her to ensure that she is following those very strict practices of infection prevention and control, whether it comes to meticulous adherence to hand hygiene. A simple thing like, for example, if the patient has a central line, the number of times you handle that central line, every single time the nurse has to ensure that she is meticulously cleaning her hand, she's following strict aseptic techniques when she's handling this line, because even one lapse can lead to an infection. So that is how meticulous they have to be when it comes to handling these patients, especially a lot of them may be immunocompromised, a lot of them may be having immunosuppression in terms of the treatment that is being given to them. So, when it comes to infection control, yes, that's again a major concern, because today we're talking about antimicrobial resistance and all of that, and nurses do play a very important role in preventing infections. The other important things that we talk about patient safety is fall prevention, prevention of injuries while in the hospital, and that we have seen is predominant in, I would say, especially when I'm now in the south, it's very predominant because people here are quite active. Unlike, I think, people in Mumbai or maybe Delhi also. People here are very active. They're most of them are farmers. They've been used to doing things even right up to 70, 75 years of age. So even if you keep educating them that you're in a hospital now, you need to take care, you need to call the nurse, you need to do all of that. But by virtue of being, considerate, they would say that I can just go to the washroom. I don't need to disturb the nurse. I don't need to disturb my family member who's there. And they would eventually fall. So, and this can lead to a lot of injuries as well. So, a nurse plays a vital role, because what we do is we ensure that the nurse visits the patient every hour almost, especially in the nights, to ensure that they are comfortable, they're sleeping, do they need anything, do they want to go to the washroom, so that we try and prevent all of these injuries that a patient can have. And effective communication is another important role that a nurse plays, because communication is one of the key reasons for adverse events in healthcare. A nurse, as I said, is that central point. She's the one who communicates with all the other healthcare people to ensure that the right care is given to the right patient at the right time. Also, when it comes to patient education, she's the one who will actually sit with the patient. She's the one who will actually explain all those complex medical jargons in simple words, so that the patient understands what is happening to me. And they also participate in that discussion, and they also become decision makers, rather than it being a one-sided decision and something being done for the patient without them knowing what it is. Um, Also, a very important role that nurses play is that of being a whistleblower. She or he is the one who usually raises, what we call as um, yeah, a reporting of incidences, whether it be something that they made a mistake, or whether it be something that others made a mistake, an error. We are all human beings, it can happen. But they are the ones who usually report it. And with an intention not to blame anybody, but with an intention to improve the system. So you go to any hospital, you would realize that the maximum number of reports, such reports, are being reported by nurses. So they are the ones who do that. And very importantly, from a patient's safety perspective, I wouldn't call it an error, but they are the ones who are there at the bedside to pick up things, pick up things when which can deviate even a little bit. For example, the patient, you find a patient suddenly, the lips have just gone haywire, slurred speech. Nobody is there to look at that. It's always a nurse who picks that up. It's always a nurse who will raise an alarm and call people and make sure that immediate intervention is done. In fact, the other day I was walking onto the passage of my ward, and one of my patient's relatives, she was holding on to a nurse and taking her. So I was wondering, where are you taking my nurse? She said, I want my husband to see her because she's the one who identified that he had collapsed, and and she's the one who raised an alarm and immediately called all the rest of the people, and they managed him immediately. He was shifted to the ICU, and now he's back, and we're getting discharged today. So I wanted him to see her and know who's the one who saved his life. So that these are the things that nurses do, and to prevent adverse events in an hospital and make sure that we have great patient outcomes.
It kind of gave me goosebumps when you were telling me this, because this is actually something that I've also seen in the hospital, the role that nurses are playing in identifying, subtle signs
Yeah.
just because of their power of observation. Uh, you know, this brings me to my next point, that beyond clinical care, nurses are instrumental in service excellence, right? I mean, you said that they are the biggest whistleblowers in a healthcare organization. How do their interactions with patients and caregivers shape the overall healthcare experience that people can expect in an hospital?
Yeah, as I rightly said a little while ago, nurses are not purely just clinical care providers. They really go beyond that, and they are the ones who would be spending time with the patient, talking to them. So they play a very crucial role in shaping the overall healthcare experience of the patient by offering that compassionate care and support to not just to patients but also to the families as well. So today, this interaction that they have kind of helps the healing process, and it's always, it extends well beyond that technical aspects of patient care. It's much more than that. Today we have, like, in here, I've seen a lot of patients who come back to visit our nurses. Now these are patients who have probably been admitted in the ICUs. These are patients who've undergone organ transplant. Recently, the other day, I was at the lobby and I see a patient who's come in, and he underwent liver transplant. So he came to see my nurses in the liver transplant unit. So he comes almost every few months to come and see them and say hello to them, and because he says it gives them a certain positive vibe, and he refers a lot of other patients. So that's indirectly, we have been involved in marketing our hospital, though we are not actively involved in marketing and that kind of thing, because I think at the end of the day, it is an experience. If I have a great experience in this particular hospital and I go and talk about it to 10 other people, that is what is going to get more patients. Whatever hoardings you put up, whatever social media things you do, at the end of the day, if I have to undergo a major surgery, I am going to ask 10 people about it. I'm going to ask them, what was your experience? And that is what will enable me to take a decision whether it is this hospital that I need to go to, or probably to the neighbor, hospital in the neighborhood. So that is the role that nurses play as far as service excellence is concerned, and or the experience is concerned. And we know that illness can be a very stressful and an emotional experience. So not not everybody in the hospital has the time to sit and talk to a patient or sit and talk to a relative. So recently I had another patient who was admitted in my hospital. And the irony is that he came in for the funeral of one of his friend, and he had a cardiac arrest at that funeral, and there were two nurses, I believe, there. They offered him cardiac resuscitation and all of that. They shifted him to a hospital, but he had brain issues because of the delay in, getting medical care. He came to our hospital and he was here for almost 6 months. And he sent out a very long letter to me saying the kind of experience, not he, I'm sorry, his wife, sent a long letter to me saying the kind of experience that she had and how the nurses made sure. This is a missionary hospital we run by priests. So how the nurses ensured that the priests came in, they said the prayers every day, and the kind of experience that they had. So that was all much beyond the clinical aspect of care, and that is where I think the nurses make a huge difference.
Fantastic. Fantastic. I'm so glad that you shared this because this is a story that really needs to go out. And Dr. Elizabeth, looking ahead, what steps do you think can be taken to uplift the nursing profession in India, both in terms of recognition and career growth, to ensure that there is a sustainable and motivated workforce that we are building in our hospitals?
It's a challenge. It's really a challenge to have because I see this as a very long-term process when we're talking about developing nurses and creating a sustainable workforce here. Because the first and very important aspect to look at would be enhancing nursing education because the nursing curriculum is kind of outdated when we talk about where we are today as far as the healthcare complexities are concerned, the advancements in healthcare is concerned, and I mean, I am to blame as much as every other person in the nursing fraternity is that we've not been able to kind of change that curriculum and bring in, make it a lot more robust in terms of making nurses ready to take on that job that they have when they come into the so-called real world of nursing practice. We call it a practice because it's constantly, you have to keep on practicing to get better and better at it. But having said that, I would want my nurses when they come out of nursing college to be at a certain level so that it's easier for us to be able to get them onto the job. Because as I said today, we spend about 2 to 3 months training and developing them to make them competent enough to handle patients independently. So it's very important to enhance nursing education, make it more practical, make it more realistic, make it more, related to the current situation and the current age that we are in, and prepare nurses for the future of healthcare. So that is one important aspect that is very, very, very critical as far as you know, making nurses comfortable is concerned. The other aspect is improving the work environment, improving the compensation. If you want nursing to be lucrative, if you want nursing to be looked at and seeked by a lot of youngsters, it has to be, uh, that interesting for them. It has to be made that interesting for them. While it's got its other aspects, there's a lot of adrenaline rush, in terms of being a nurse because you really don't know what's going to happen in the next moment. I mean, not being biased, but when I started off my nursing profession, I had a choice of, I tried both. I tried being at the bedside and I tried being a nurse teacher in a college of nursing, but I couldn't do the college of nursing part of it because I really enjoyed being at the bedside. And the reason I enjoyed that is the simple thing that I don't know what's going to happen in the next moment. You would have an ICU which is very quiet, you're comfortable, or your patients are sleeping, and you just sit down thinking, okay, I'm just going to, whatever, do a little bit of documentation, do whatever. The next moment, boom, something can go wrong. So that's how the work environment is, and it is exciting, unlike a very routine job that you want to do. But I don't think people are aware, youngsters are aware of that. And what they really see is the not so happy side of nursing. So it's very important to showcase that. It's very important to, of course, uplift the working conditions of nurses and create an awareness among the youngsters that this is a profession that you can look at and there are opportunities for growth. Enhancing recognition, creating career pathways is very, very important, I think, in our country, especially when it comes to advanced nursing roles. Somehow, I think when we're talking about nurse practitioners and those kind of roles, which are quite evident and pretty established now in other countries, when we're talking about nurse practitioners, countries like the UK, the US, they cannot do without them now because They are so become dependent. It's more of a kind of a relationship that goes hand in hand. But somehow in our country, there is a certain, I don't know if you can call it insecurity or lack of it, that people are not happy to encourage, nurses taking up these roles. But I think that's very important if you want to retain your nurses in the country, if you want to enhance the healthcare, it's important that we give a career path and create these kind of roles for nurses. The fourth important aspect that I would look at is leveraging technology. It's very important for us to get nurses to move out of those routine, a lot of times mundane tasks that they do, to make sure that they're able to focus more on patient care and spend a lot of their time onto patient care and patient interactions. There are a lot of technologies that are now available which can convert to making sure that nurses have enough of time to take care of their patients. So we need to leverage that. For example, remote patient monitoring, we've got environmental monitoring, we've got electronic medical records. So all of these put together is going to make sure that nursing time is given more value, and that's given purely to patient care rather than administrative tasks. So I think if you're able to look at all of these key strategies, India can create a nursing workforce that is skilled, motivated, respected, and equipped to meet the evolving needs of healthcare in our country.
Fantastic. Dr. Elizabeth, you beautifully brought out the diverse yet critical role that a nurse has, and just keeping in mind that the time that they spend with the patients on their bedside, they create and manage an environment of trust, because the empathy and the compassion, even though doctors also have it, but they're there only for that visit or at the time when the treatment or a surgery is done, when the patient is not completely aware as to what is happening. But in his full awareness, it's the nurse which is spending the most time with the patient. Second is, you also spoke about administering pain management under the guidance of the doctor. Now, it's a very critical role because, you also brought out that how observant nurses can actually take notice of the subtle signs that can be really, really important and could be really negatively impactful if they were not to be noticed on time. So, truly, I mean, if I were to understand correctly, it's a nurse who plays a holistic role in a institution where healthcare delivery is happening, and they are the ones who are not just doing their work but also bring out the emotional support that the patient and their family needs at that point in time. Thank you so much for taking out time to have a conversation with me on this. Thank you so much for bringing out the role that they have in patient safety and quality in an institution. Thank you so much.
Thank you very much. Thank you very much for having me and having this chat with me and giving me an opportunity to showcase what my nurses do. Thank you very much.